Giddy up. It's Tuesday, June 4th, 2019. I'd like to call to order the Ways and Means Committee. Please take the roll. Here. Here.
Yes, I'm
Here.
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 Next on the agenda, the minutes of 5/7/19.
A motion approved.
Support.
Any discussions? Seeing none, all in favor?
Aye.
Opposed? Motion carries. Is there any public input? If anyone from the public would like to speak, this would be a good time to do it. And seeing no one in that vast audience, we will move on to petitions and communications. First on the agenda is Bay Arenac Behavioral Health Services Community Mental Health Services Update by Chris Pinter, the Executive Director. Chris, take it away.
Thank you, Mr. Chairman. Page 7 of your information tonight, I gave a little summary. There were 3 things that came out of the appropriation boilerplate process that actually counties were interested in, not just county mental health programs, but actually county governments were interested in. And I wanted to just give you a quick overview on 3 of those, and of course 2 of them you're already aware of, so this will just be a little bit more information for you. The first one is the Carroll Regional Center replacement. I know the commission took a position on that a few weeks ago. It looks like right now Arenac County is going to do the same next Tuesday, so we have at least 6 counties that are opposing the governor's feasibility study, and she's suggested that Carroll might not be the best place for that hospital. Obviously, those of us who use that hospital want to be physically closer to that center than where if it was located further away. So I was glad that Bay County did that. I'll be even more glad when Arenac County does it next week. I think it's important that we not only get the beds and the increased number of beds because we need them, but half of those beds will go to the Tri-County area. So we don't want that facility located any further south from here than it's possible. So that's why I appreciated the county taking a position on it. So the beds are important, the location's important. So I appreciate you doing that. The second item is, this is a new item. I haven't raised this issue with the commission before, so I may test some folks' memory who've been involved in county government. But I've titled that Local Funds for the Medicaid Program. And for those of you who've been involved with this for a long time, I'm not looking directly at Mr. Barsha, but in the old days, 40 years plus, the state would put up 75% of the money, and the counties would have to put up 25% of the money. That's how all the county mental health programs were funded. And over time, the state reduced the county's share to 10%. Eventually it became 90-10, 90% state, 10% county. That's still how it is. It's still 90-10. However, the state gets more than half of its 90% from the feds through the Medicaid program. So their share of that 90% is much less than it was, say, 40 years ago. It's bigger in total dollars because the program's grown, but more than half that now is federal money. So that's allowed them to not require as much of a commitment from the counties that say they would have 40 years ago. So think 40 years ago, I'm a $45 million organization. If Bay and Arenac counties had to put up 25% of that, that's $10 million. So we're pleased with our $688,000 appropriation we get from Bay County each year. We're more than happy with that. So the reason this is on the map for the boilerplate is some of the counties up north, and I included a copy resolution from Benzie County, they put the math together and figured out that really the county commitment to the Medicaid program is different than the county's commitment to the 90-10 split in the mental health code. And what I mean by different is right now, the 46 county mental health programs collectively put $25 million of local appropriations in, and then the state uses that to draw down another 40, 50 million of Medicaid. But theoretically, the state could use general funds to cover that $25 million and let the county mental health programs keep their local appropriation. So people say, well, what's the big deal about keeping the local appropriation? And for me, right now, between the 2 counties, it's almost $800,000. I have to send $500,000 of that. The day I get it from Bay County, I wire it to the department. It's required by boilerplate. And then they use that to get federal money, okay? If I didn't have to do that, if I were able to keep our Arenac and Bay County appropriations We can use that for public mental health services. We have no Medicaid, no state strings. Bay County could use, as long as we were meeting our mission under the code, as long as we was consistent with our bylaws as an organization, as long as we could all, in good conscience, tell the members of the public how we're spending their money. We have lots of flexibility with that local appropriation, as long as it's for mental health services and supporting services under the code. So some of the northern counties have figured out that that money would be actually more flexible. They could use it in their jails. That's what we do with some of our local. They could use it in their juvenile detention centers. We do some of that now with our local. It would give a lot of county, well, it would add 25 million basically in local appropriations that counties could use for mental health services. So a few old county commissioners are now in the House, put language in the boilerplate for next year to phase that out over the next 5 years. Essentially then allowing a lot more flexibility locally with those funds. So I just wanted you to be aware this is the first time in 18 years we've got something in boilerplate that actually says we intend to phase this out. And what it means, and what I've told people what it means for Bay County is our board would probably make us spend it all on substance abuse and service, populations that we can't free up enough Medicaid for right now to pay for that are a public health problem in the county, and Arenac County would do the same thing. So I'm cautiously optimistic as this plays out. Maybe it'll give us some more flexibility locally on the services, and I just wanted you to be aware of that.
Commissioner Krieger.
So Chris, my question to you then, have we had any conversation with Representative Elder or Senator Daley as far as any kind
This
of-
particular issue?
Yes.
Historically, but not recent, because we really were surprised it got in the House appropriation language. So my plan would be to make sure that both of them know that we support it. The lift will be in the Senate, because it's in the House bill. It's the Senate one will be tough, because it's not in theirs. But absolutely, I wanted the county to know why we were going to press for this, because sometimes some of these issues, they come up and the county mental health programs want to push them, and there's a political downside to them, and it's not worth pushing. Since so many counties have independently pushed this issue, I think it's worth raising, because it makes the voice stronger if it's a combination.
So one of the reasons for being here then would be to ask the board if we would consider the information and put a resolution together to send to Lansing?
Absolutely. It's always important to hear from the county governments, even if like revenue sharing, they don't tend to listen. It's always important because they give more credence to the counties than they do a lot of other advocates and stakeholders. So if you'd consider, I just wanted you to be aware, some other counties have done that. That's something for you to think about.
So, Mr. Chairman, I'd make a motion when appropriate to have a resolution put together that would support.
Okay, we'll wait till we bring this in, then we'll do that right away.
Okay.
Commissioner Coonan.
Chris, you were talking about, near the end of your discussion, population, you can't free up enough money to provide services. Is that something that you...
The substance abuse, obviously, nationally, we've got an opiate crisis with substance abuse, with people accessing prescription painkillers and then later using those to move on to heroin and other illicit drugs. There's not enough substance abuse money in the system in Medicaid or at the federal level yet to make the type of difference in the communities to treat substance abuse, because it's so pervasive. And so using that, recognizing how important to my board substance abuse issues are, if I had a little more flexibility on local money, I can pretty much guarantee you that unless the commission told them not to, they would want to use that for substance abuse treatment in the areas of the county where there's the most pervasive problems.
Okay, sounds great, thank you. Now, where would the state have a problem with that?
The issue will be that, and I'm not trying to be funny, but every time we have raised in the 19 years that we figured out that technically you don't have to take our local appropriation, you could let us use it for local services. Every time we've raised that issue, they've almost acted like we're skipping out on child support. That, well, no, that 25 million, that draws federal, that's your share. No, the county share is the 90-10, and as long as the county maintains its effort of providing services under the Medicaid program, they've met their obligations. So this 25 million at some point became a litmus test in the legislature about the county mental health program's commitment to keeping its end up and providing services. So That's one reason why I never brought it here, because there was no sense taking a position on something that is just not going to go anywhere. But several other counties are now aware of this and are pushing it, and I think it's worth Bay County just thinking about. And I did the same with Arenac County last week. I asked them to consider it. It's a political red herring.
Any other questions?
Thank you, Mr. Chair. Chris, I too wanted to weigh in. Thank you for your leadership in bringing not only issues of importance to the Bay County Board of Commissioners, but throughout the region, and especially the 2 counties that you work diligently to represent. And yeah, if you look at the trend over the last couple of decades, the legislature has, been declining in their support. And also, I know the future of the Carroll Regional Center is very important to Bay County, to Tuscola, Saginaw, especially Tuscola, but the whole region will be impacted, especially the services that your organization provides. If it, for example, did go to Genesee County, it would be quite a probably a major impediment to having the access that we have to those beds out there in Tuscola.
Yeah, I would prefer it be in Bay County or northern Bay County for my Arenac County folks who might be here closer to Arenac. But the further south it goes, the more it'll be absorbed by the metro county. That area is so big, they have half the population, and it will be harder to get beds even in an expanded facility. Mr. Chair, could I just add one more thing? I just realized I almost skipped over my last part of my report. It's the section 298. Now, this commission knows all about that because 3 years ago, Bay County was the first commission to go on record, and I included it in your information just as a reminder on page 13, was the first county to go on record opposing that back in 2016. That was the plan to just transfer all the public funding to the private Medicaid health plans, not have the counties involved anymore, not have county mental health programs. We've been fighting this back and forth for about 3 years. A few times it looked like Governor Snyder and Lieutenant Governor Calley were letting it go, but then the health plan lobby has billions of dollars, and they were always able to get some people in the legislature to advocate for them. So where we're at right now is there's 4 county mental health programs that are supposed to do a pilot with their Medicaid health plans: Saginaw, Genesee, West Michigan, which is Lake, and Oceana, and Muskegon. And the problem is, the reason I'm raising this 3 years into it, is A, we weren't going to volunteer, and B, we don't think it's a good idea 3 years later. The state has never gotten federal permission to do this 298. They actually have to put it in their Medicaid waivers, right? They actually have to ask, oh, by the way, we're changing, we're going to give the money to the private sector first, and then, so there's actually a public comment period to go on record, again, opposing this, and I think the new governor is probably not aware of the amount of county opposition and opposition from MAC there was 3 years ago, so it's a perfect time to go on record. And in fact, I included in the last information I sent for today, pages 14 and 15, I included a draft of the letter that our board sent. That is one thing. The county passed a resolution opposing it in 16. There was a subsequent resolution the fall of 17 that the county passed related. So something to think about would be if you wanted to send a letter or communication directly to the Medicaid agency saying, we don't think this is a good idea. That would be the one ask I would have for you to think about. The timeline for it is, it's really, Jim will know more about this. There's 5 Medicaid waivers, okay? There's 5 waivers. They all have to get renewed for October 1st, right? There's the 2 big ones, which relate to this 298, and then there's 3 smaller ones that kind of relate, but not so much. So in May, they sent us a letter and said, the waiver applications are out, public can comment, because they have to ask the public if they're going to change Medicaid policy. Even though 3 years ago when the public resoundingly said don't do it, they still have to ask them 3 years later. Only 3 of the waivers have been posted, and not the 2 big ones. So we don't know if there's going to be a delay another year. Saginaw has made noise about, they finally figured out maybe they would get paid for all their bills if it was privatized. I don't know why it took them 3 years, honestly, because I told them that 3 years ago. But, so I don't know if this is going to get delayed or what. So I would ask the commission, if you think about sending a communication, in which I really encourage you to do, just let me let you know if that timeline has changed, because technically, the 30 days can't start until all the documents are out for public review, and 40% of the documents aren't available yet. So I don't know if they'll discard our feedback and say, oh, you commented too early, or I just don't quite know on the timing. So I would just ask if you do pursue a communication, which I encourage you to do, I'll try to coordinate with you on the dates so it has maximum impact, because we're trying to get all the counties that were opposed to it to try to comment in the same window period so that for maximum effort. So
Maybe you could coordinate with Deanne and, and bring them.
Absolutely.
She could bring something back to us so we could look at it. and then we
sure.
could Send it forward.
Sure.
I think that would be the best way to do
Okay,
that part
absolutely.
of it. Because I think most of us will be lost trying to put that whole thing together, what you're talking about, just the letter itself. And you are the expert in that field, and that'd be a great help to all of us, I think.
I just wanted you to know the timelines, why they're mixed
Sure.
up, because they've not released some of the things. So technically, they have to start the clock over.
Commissioner Begic.
Yeah, Mac's been opposed, well, trying to fight it as best you can. Sometimes you have to compromise and do things like the
That's
pilot
right.
project. So that was.
That's exactly
sort of
right.
Compromise to do a pilot project, and, but they've sort of been opposed to losing local control and letting private insurance take over.
Absolutely.
Commissioner Krieger.
So with all being said, I'd like to move to receive Chris's report, and then
We'll do that. We'll do that, then we'll go back to you. All in favor? Opposed? Motion carries. Now, Commissioner Krieger.
Then what I'd like to do is ask Chris to coordinate with Deanne, if we could, on information that the board can review, and then bring it to our next full board meeting to acknowledge the resolutions and pass them as written. Okay?
Support.
All in favor?
Aye.
Opposed? Motion carries.
Thank you.
Thank you, Chris.
Thank you, Mr. Chairman. Thank you for your time today.
Next on the agenda, from the Sheriff's Office, the 100 Club of Bay County donation.
So moved.
Discussion. The only thing I'd like to say about, I think, the 100 Club, but a lot of people don't understand what they are, or who they are, and, it was started by, for police and fire families, it started as a means if there was a injury or a death, and they would make donations to the family, and now it's evolved into they have some extra money, and they support law enforcement projects and fire projects within the community that they serve. They do an excellent job, and we know they have a big meeting once a year. We'll call it a meeting once a year that they have, and many people belong to it in Bay County now. More than it started, I don't know how, maybe 25, 30 years ago in Bay County, and it's grown vastly since then. But do a great job. And that's all I want to say about it. But so 100 Club, thank you. A lot of people don't know who you are, but you keep up your Facebook posts, and they will. Any more discussion? Seeing none, all in favor?
Aye.
Opposed? Motion carries. And the memorandum of understanding with the Pew Charitable Trust, Michigan Joint Task Force on Jail and Pretrial Incarceration.
So moved.
Support. Discussion. Seeing none, all in favor? Opposed? Motion carries. From the Drain Commissioner, soil erosion sedimentation control permit fee schedule.
So moved.
Support. Discussion. Seeing none, all in favor? Opposed? Motion carries. From the Personnel Director, tuition reimbursement for Leah Fournier.
Motion to receive.
Support.
All in favor? Opposed? Motion carries. Oh, Commissioner, Mr. Krieger.
Just a question.
Yep.
So, Ms. Tim, so we're watching our funding and stuff, correct?
Yes, of course.
I just want to make sure, because every time one of these pop up, there's a little more money being drained out of our general fund, and I know that we've put a budget in, and maybe at some point, maybe the end of July, August, you could come back to us and say, okay, this is what we budgeted, this is where we're at, this is how much we have left.
Yeah, and Commissioner Lutz had requested for me to start putting it on the request, so we do have them on the request now, what the current budget is, how much we've used, and how much is left, so we'll continue to put that
All
on
right,
there.
sounds good, thank you.
No more? All in favor?
Aye.
Opposed? Motion carries. From the Director of Recreation and Facilities, the fireworks festival parking lot lease agreement.
So moved. Support.
Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries. The CIMCO contract for system review, inspection, and on-site training for refrigeration system at the Civic Arena.
So moved.
Support.
Discussion. Commissioner Krieger.
Yeah, Kristen, how many people are actually going to get trained on equipment?
For sure, two. Steve, our head maintenance guy at the Civic Arena, and Andrew, our operations manager, and we'll probably have a backup from buildings and grounds.
Okay. Okay. Very good. Thank you.
Seeing no more discussion, all in favor?
Aye.
Opposed? Motion carries. Interstate Hockey League contract.
So moved.
Support?
Discussion. Commissioner Krieger.
So I'm just curious, are we up to date on all our contracts as far as what they have been billed and what they've paid?
In terms of ICE payments?
Yeah.
Yes, we watch them every month. Every once in a while, we'll have either a high school team or a travel team that's a handful of days past, but for the most part, yes, we are extremely up to date. We have a few little cliffhangers, but nothing serious.
Okay, that's good. I'm glad that I'm watching it, because I know back a number of years ago, there was some question on whether we had 2 slabs or 1 slab, and some of the concerns by individuals were in arrears quite a bit as far as their payments, but I'm glad to see that we're back up to.
We watch
speed.
it very closely, and Andrew has been helping out too, and so we are on top of that.
Awesome. Thank you.
Commissioner Durancheck.
Now, this is a new semi-pro league?
Yes, Andrew's been talking with him, so I'll invite him up. He can give you a little bit more details, but there's going to be 12 teams in the state of Michigan. They're in Alpena and Grand Rapids and the Lansing area and all over the place, and it's brand new, and they want to host one team. I think that's the Bay City Americans will be the name.
Yep.
At our arena. They'll pay up front. They get so many ice times. After that number of ice times is over, they start paying by the hour. And they want to do some improvements at the arena that would be ours to keep. So it sounds like a wonderful opportunity for our rink.
It does. The economics of the whole thing just seems like it's a win-win deal for them and us.
Yep.
Sir, could you state your name, please?
Andrew Cowan, Operations Manager.
Just give us a little, I know you want to say a little bit about this, Lisa, go ahead.
Right, I've been in contact with Drake over the past several months over this Interstate Hockey League, and he's gotten quite a bit of sponsorships, and I feel like it's going to be a good league, good thing to be part of. They're semi-pro, so it'll draw some more attention to our rink. It'll be interesting to see how many fan base they do pull out of it, but for both sides, it's a win-win. So they get a lease agreement, we get the guaranteed revenue off of that, and both sides benefit. We get some updates at the rink, and if they're there for a long period of time, it's only going to benefit us. Per each game, our Youth Hockey Association will get $2 for every ticket sale, so it benefits our hockey association too, and we need to make sure that they're doing well so we do well. I mean, everything just feeds off of one another, so it'd complement each other quite well.
Commissioner Begic.
Is that a historical question? Wasn't there a Bay City Americans at the market?
Yes, back in the 50s and 60s.
You're making us all
Yep.
fun.
And they saw that at the rink, and they thought that was really cool, so that's why they went with the Bay City Americans, because it was going to be the Bay City Muskies, which was kind of just weird because there's really not too many muskie around here. So Bay City Americans will work out a lot better for them.
Commissioner Krieger, did you have a question?
Yeah, I just wish you would have been here 10, 15 years ago, but back then you were probably still in high school, so.
Yeah, I was at the rink, but I was in the concession stand driving the Zamboni, so.
I'm certainly glad that you're actively involved. The county will just prosper from this, so congratulations.
Thank you, I appreciate that.
Commissioner Coonan.
What are the ages? It's not junior hockey.
No, it's adults. It's anybody that's over the age of 18. So you could have somebody that's 50 years old out there. So it's a very big market that they could get into.
Looks like we're covered. Thank you.
Thank you.
No more discussion, all in favor? Aye. Opposed? Motion carries. From the Housing Director, the HAAS contract renewal.
So moved.
Support.
Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries. And the purchase of a new commercial mower.
So moved.
Support.
Discussion. Commissioner Coonan.
Is that, I didn't see what's gonna happen to the old mower. Is that a trade-in or
No, we're gonna go to one bid with it.
gonna what?
We're gonna send it to auction.
Oh,
So the one company that we got a quote from, they wanted to buy it, but it'd be for parts. It wouldn't be worth much. We could get much more at
Does it
one bid.
work?
Oh yeah, it works.
how big is it?
It's a 52-inch deck, Cub Cadet, and we're just over 2 acres. We're gonna be going to a 62-inch deck, so we'll save a little bit of time as far as when we are out there. The suspension on ours right now is pretty much shot, and the hydraulics on the arms doesn't work. The new zero turn that we want to go with is actually a steering wheel zero turn, so.
Thank you, sir.
Thank you, Zach. All in favor?
Aye.
Opposed? Motion carries. And from the Directive, Department on Aging, acceptance of grant money from Civic League of Bay County Advisory Endowment Fund of the Bay Area Community Foundation. Whew, that's a lot.
So moved. Support.
Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries. And increased funding award from Region 7 Area Agency on Aging.
So moved.
Support.
Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries. From the Health Director, transfer of reserve funds to family planning budget.
So moved.
Support.
Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries. Payables, General and Center Ridge Arms.
So moved.
Support.
Discussion. All in favor?
Aye.
Commissioner Coonan.
Let me just go back to H real quick. When I was reading that earlier. Beth, did we talk on that one?
I'm not H.
Okay, all right, then Joel, I didn't talk to you. Which one did we have?
How about,
Under the budget adjustment.
Oh, I haven't gotten there yet.
Yes.
All right, sorry, Joel, but it's good to see you.
All right.
where were we at? We're at the payables? We're in the payables? Where were we at? Okay, payable, we're at the payables again. All in favor?
Aye.
Opposed? Motion carries. From the Finance Officer, budget adjustments, Soldiers Relief Fund, Department on Aging Fund, Golf Course Fund.
So moved.
Support.
Discussion. Commissioner Coonan.
When I called you on this, Beth, on the aging fund, and that was where you were asking for a budget adjustment because you had some folks that were on.
Yeah, we have 5 people off right now due to workman's comp and to own medical leaves. And we had to hire a temporary agency, and I need to replace the funds that we use for the temporary agency. And then I want to put some extra funds in there just in case of having to use a temporary agency. But we did stop the temporary agency and have reworked with the people that we have some other options.
Because I'm not a big fan of temporary agencies, number one. And secondly, if you had people that are on workers' comp or disability or what have you, they're not drawn from that line item. So
Right.
I don't see,
Yep.
you may have a reason for having a budget adjustment,
Right.
but if you've got whatever number of people that aren't drawn from their wage line item, but they're drawn from workers' comp or whatever, why would we need this?
Temp agency was just a little more money. We had 2 people go off, and then we had 3 other people go off, like bang, 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 you know? And I wanted to be able to get that, get the services to our seniors
Absolutely.
out there, yeah.
Now, are we able to bring in other people on a per diem basis that we don't
We
have to go
just
through?
we just hired another on-call, and I just sent up a request to hire a second on-call.
Because that's tough enough work as it is without the temp agency getting a chunk of the wages.
Correct.
And folks,
Correct.
you
Yep.
know.
But we did Tiffany and I talked, and we did some rearranging of my staff, so we are going to be better
We
off.
can avoid temp agencies to me.
In a pinch, they work. In a pinch, they work. And that's where we were.
And Commissioner Kuhn, I think where you're saying, why do you go through a temp agency? When we have people off on medical leave or workers' compensation leave, the board approves a certain amount of positions. So technically, in our system, those positions are already filled by people who can't perform the work. So in order for her to go out and get an additional employee, she would have to come back to the board, ask for an increased position, wait for up to a few weeks before the board approves that, and then post it and get it.
So that's why you go to a temp agency?
Yeah,
Correct.
because we
Why
only
would
have
we, during the budget, have a line item that would have a buffer there if this situation would arise?
We
So
do.
wouldn't have to go-
We do. I just didn't budget enough in there.
Okay. no,
Yep.
You do a great job.
Yep. That one was my fault.
There are better ways for us to conduct business than going through temp agencies.
Correct.
If we can do it.
Yep. Thank you.
All in favor? Opposed? Motion carries. General Fund Equity 2019.
Board.
All in favor?
Aye.
Opposed? Motion carries. Executive Directive 2007-11.
Motion received.
Discussion. All in favor?
Aye.
Opposed? Motion carries. Number 4, out-of-state travel to Cleveland, Ohio for Community Live Conference and Training for On-Base for Julie Coppins, Jody Rosinski, and Ann Clayton. I even said that pretty good.
Support.
Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries. Are there any referrals? Unfinished business. I get in there. New business. New business, we have a resolution that will be for the a verbal agreement with the Bay County Vietnam Monument Committee for the parking lot to use it for the 4th of July at the community center.
Support.
Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries. Closed session, ma'am.
Not at this meeting, Mr. Chair.
What?
Not at this one, but the next one.
Oh, okay. Okay. Miscellaneous. Commissioner Durancheck.
I see out of the state this morning, the state has determined that the infant formula that is passed out at WIC used to all, anything that was brought back was always given to food pantries. They would, one month it would be to Pinconning, next month Bay City, and back and forth like that. And a couple of months ago, they came up with this determination that once it comes back, it's got to go in the dumpster. Well, myself and a lot of other people, we called in and everything, and I'm here to report that they have rescinded that, so we're back to the old process, that they can, take this formula and use it. Obviously, it's double sealed and stuff, but once it comes back, they can't give it, from what I understand, is that correct? Joel, they can't use it again with another WIC program, with another WIC participant, but they can box it up, because I used to take cases of the stuff.
Yeah, we can't distribute it to WIC participants again, but we can give it to the the shelters and food pantries and things like that. So
I never realized how expensive the stuff was, and like in Big County, I've taken 5-6 cases up there before, and it's like it's gold, because a lot of these people, we have a baby pantry up there also, in this field, the diapers and the formula, that's what it's all about.
yeah, that's especially true with some of the more complicated formulas as well. So this is a good thing overall. So.
Hey, I'm glad they're reusing this stuff. I mean, there's nothing wrong with it, so why?
Yeah, it kind of question logic and about throwing it out. But
sometimes the logic goes out the window a lot.
And just to let people know, these are unopened cans of formula, not half-used cans of formula.
I guess most of them are, actually, they're double sealed,
Yes.
The can is sealed, and then there's another can that is in it, whatever. I haven't bought any in a long time.
Thank God. Anyone else on it? Oh, Commissioner.
I'd just like to make a comment on Mike's admission of what his efforts were and how it's paid off. Sometimes when you're dealing with bureaucrats, you just shake your head and go, what the hell is going on? So I commend everyone that's made a difference in getting these people to open their eyes and understand
And it
the
wasn't,
value.
I mean, that's exactly what I said to my representative, who's Representative Glenn. That's just how I put it. What the hell are you doing?
Yeah.
This can't be.
So,
She got on it also, along with, I'm sure, Representative Elder and, Senator and everybody else to get this thing turned back to common
Good.
sense.
good.
Now, I don't know who makes this, somebody must have a dream and they make that stuff up and say, this is a good idea. It's usually not.
like-
Thank you, Joel.
You're welcome.
Any other miscellaneous? Announcements? Commissioner Krieger.
Yep, we're coming up on June 29th, our beach wellness, be our 5 and 10K run and walk at Bay City State Park. And the race starts at 9 o'clock, and provided he's healthy and available, I think Mr. Barsha would be the one starting the race again this year, so.
I'd be honored to.
Yeah,
Kelly.
it'd be great to have you there.
He might run
And you still can enroll online. If you want to give the email address.
Well, we already have, I think, maybe 25 online entries, and most people do go online. A lot of people wait till the day out to see what type of
With
day
the weather,
it is.
yeah.
But it's runsignup.com, and it was very nice. Bob brought over a brochure designed by the county, encouraging all of our employees to participate in receiving their fee back, which is good. We started this many years ago, Bob and Ernie and I. The beach wellness was wellness for the beach and wellness for the employees, because way back when I started, healthcare still is a major cost. And we thought if we could get people, and I was doing this based on my experience. I went out there, I couldn't believe it, because I worked a couple of jobs my whole life, and I didn't realize what we had out there. And I went out there and I just felt so new, or so good. And I thought if we could get people to experience that whole area out there, and Pinconning as well, what we have in our community. And I think, we hope it has. We hope that we have looked at our employees and with what the administration has done over the years, allowing people to go see a doctor, not have to pay any for the prescription or the copay, and taking better care of themselves and having better habits. And in the long run, that does reduce healthcare costs. So this goes back quite a number of years ago when we started this, and wellness for the beach, which is good for the community, and wellness for the people, which is good for the people. And we don't raise as much money as we used to on this, but we're always raising awareness, and that's the key for the community is awareness. So we'll have some fun this year, and we'll raise a few bucks, and I was out walking the beach, and it's fabulous. There's not a lot of muck at all, and we've got a beautiful resource there for people to enjoy at no cost, really. No cost. Take your family out there. Everything today is expensive, and we do have a lot of. They were talking about unemployment. Let me get out of this real quick. We talk to people all the time. We have 3% unemployment, right? That's beautiful. Everybody's working that can work. 48% of those people work and qualify for governmental assistance. And I think we have to be very cognizant of that, where everybody works today. A lot of people are working 2 jobs and 3 jobs. And if we can get those people out to a recreation area that we have, whether it's camping or the day park or Topico or wherever it might be, Pinconning Park, and just enjoy the day, that creates a better quality of life for them. And that's our role here, is to do what we can do for people that we can do within the constraints of the budget that we have. And I think recreation awareness is just good stuff. So we're going to continue to do this and raise awareness and hopefully help families out.
And I'll just say ditto.
Commissioner Durancheck.
Not to be outdone, but as a warm-up to that wonderful race, on June the 14th and 15th is our 36th annual Cheese Town races. And Saturday night, we have our fireworks and polka and all the other good
Is
stuff.
there going to be cheese there?
There will be cheese. Cheese to hand out. And if you run, you get a little hunk of cheese
Yeah,
also.
wheels.
I don't know about the wheel. That's all I have.
Thank you. Any more announcements? Oh, yes, sir.
Thank you, Mr. Chair. Just real quick, this Saturday from 10 to 1 at the Bay County Fairgrounds, there's the 5th annual Paws in the Park. There'll be quite a few vendors out there. I believe there's 16. Bay County Animal Control is going to be doing $25 cat adoptions. So go out there, and it's supposed to be a beautiful day.
I found the cat in my house the other day. I don't know how it got in there. But I'm not a good big cat, but I just shoot him away. Next on the agenda.
Motion to adjourn is always in order.
All in favor?
Aye.
We are adjourned.
Sure.